Hi, I am Dr. Arun Sanyal, Director of the Stravitz Sanyal Institute for Liver Disease and Metabolic Health and Interim Chief of the Division of Gastroenterology, Hepatology, and Nutrition at VCU. I came to this institution in 1987 as a first-year fellow and never left. And it has been a privilege to work here for the last 3 decades as a faculty member in this division. Our program remains a state-of-the-art institution where we have not only state-of-the-art clinical care, but it is closely linked and integrally associated with patient-centric research and approaches to develop an active learning environment where we are continuously learning from our patients to improve the care that we provide. So if you are looking for a patient-centric fellowship experience that is scholarly, that is academic, exposure to an exceptional spectrum of disease and set of experiences, global connectivity to the best of the best, then VCU and our program should be on your list of programs that you consider for fellowship. Now, you will hear from some of my colleagues and our current fellows about what they think is special about VCU and our fellowship program.
What is unique about our fellowship program is the infrastructure and the systemic support that we receive from GME, our divisional and departmental leadership, as well as School of Medicine. There is a strong emphasis on education beside obvious emphasis on a patient care. Specifically for our Gastroenterology Fellowship program, we have a wide range of expertise, ranging from a very robust liver transplant program. We have a liver institute with a strong emphasis on a scholarly activity, IBD program, large volume of endoscopic procedure, as well as therapeutic endoscopy program. Some of my colleagues will talk to you about our other non-ACGME fellowship as well. We don't like to rest on our laurels. We continue to evolve based on what we hear from our fellows, so they are prepared for the future.
So I did my fellowship here from 1996 to 1999, and I know for a fact that our program is very, very strong in endoscopy. So we do have an endoscopy center outpatient where we do our healthy patients screening colonoscopy, and our second and third year rotate through this. So they get exposed to like the routine colonoscopy that happens in healthy individuals. The fellows, whether they are in advanced training or they are doing their routine fellowship, they get exposed to a wide variety of procedures at both the outpatient endoscopy center and the inpatient endoscopy centers.
One of the strengths of our training program is in liver disease. That includes the breadth of experiences that all of our trainees get to have. Not only are we a major liver transplant program doing over 200 liver transplants per year, we also have an active adult-to-adult living donor transplant program. On the non-transplant side, all of the trainees get to experience the entire breadth of liver disease. We have specialty clinics that focus on certain areas, such as MASLD, alcohol-related liver disease, viral hepatitis, HIV-related liver disease, sarcoid-related liver disease, and cholestatic and autoimmune liver disorders.
Hi, I'm Steve Bixton. I'm one of the GI faculty here at VCU. I specialize in Crohn's and ulcerative colitis. We have the good fortune of having 4 going on 5 colorectal surgeons who are able to work together with us for our patients with complex inflammatory bowel disease, and that's of benefit to our trainees and of course our patients. We have strong radiology, strong pathology, and a responsive laboratory department as various tests come online for the management of patients with Crohn's and colitis.
Our transplant hepatology program has 2 positions. We have a 3rd-year advanced fellowship position for a 3rd-year GI fellow, and we also have a 4th-year position. Both of these are ACGME, so that you can become board certified in transplant hepatology at the end of your training. Our transplant hepatology fellowship is evolving every year. You'll work very closely with me as your program director, and I have a longitudinal curriculum where we will try to get through each aspect of transplant hepatology so that at the end you come out as an excellent transplant hepatologist.
My name is Brian Davis. I'm a staff physician at the Richmond, Virginia Veterans Affairs Hospital. I am also the medical director of liver transplantation and the site director for the GI Fellowship program. So one of the key benefits of being at the VA is our faculty. We have 12 full-time GI physicians at the VA, one of the largest divisions in the country. We have 6 GI-focused physicians and 6 hepatologists. And our faculty have a wide range of expertise, from teaching endoscopy to being experts in the esophagus, motility, inflammatory bowel disease, advanced endoscopy. And on the liver side, we have faculty who write the guidelines for acute on chronic liver failure, fatty liver disease, alcohol liver disease, liver transplantation, and liver cancer. And so it's really important that you have one-on-one interactions with faculty, and that's really our focus at the VA.
I'm in the Department of Gastroenterology Hepatology. I'm a transplant hepatologist by training. One of the things that I enjoy about our program is the mentorship, particularly the research mentorship. And over the years, we've had many residents who've transitioned into fellowship and fellows who've done phenomenal research here. And they've published in high-quality journals like Journal of Hepatology, American Journal of Gastroenterology, Clinical Gastroenterology and Hepatology, just to name a few.
VCU is truly remarkable in that not only do we provide extraordinary training from a GI and liver perspective, but more importantly, we also tailor a fellow's experience to what their personal interests are. That can range from advanced endoscopy, general GI, where you can focus on esophagus, nutrition, women's health, as well as liver, which we are very robust in our methodology as well as our research side.
Our faculty is quite diverse, and so are our lectures and our educational programs. We have a summer lecture series that starts the academic year off with at least 21 lectures from our staff that have a wealth of experience in the entire realm of gastroenterology and hepatology. We then transition into our multidisciplinary conference, as well as our grand rounds, where we have invited lecturers from all over the world with expertise throughout gastroenterology and hepatology. We are pleased to have a fantastic continuity clinic for our fellowship program, where our fellows directly interact with our attending staff here at VCU. You'll see the full spectrum of GI and hepatology pathology and gain confidence in taking care of these patients.
Hey, I'm Spencer Harris. I'm one of the Chief Fellows for VCU's GI program here.
And hi, my name is Asya Tafada. I'm one of the other Chief Fellows here at VCU Gastroenterology and Hepatology Fellowship. So we're hopefully going to tell you why we think that VCU is a great place for us to train. So starting off with Spencer, who's spent most of his time here, done all of his medical training here. Why do you think VCU is such a great place?
Yeah, so I've been here for over 15 years, and I would say it starts with the patients. We serve a diverse patient population here, from inner city Richmond to the surrounding rural area, even to the neighboring states, as well as at our Central Virginia VA Medical Center. We get veterans from up and down the East Coast. In addition, we treat the most complex patients here at VCU, especially with regards to transplant patients, whether it's liver, kidney, heart, or in the future, lung transplant as well. But Asya, how about you? As a fellow here, what has been something that stood out to you from VCU?
So I think a question for all GI fellows when they're looking at potential fellowship programs is how good are we going to be trained at endoscopy? And what I can say about VCU is that the training here is truly phenomenal. Our recent graduates graduated with upwards of 1,500 procedures, so that's a really impressive number. So that ensures that we're going to be well prepared to deal with any endoscopic practice in any clinical setting.